Hi there. Just here to give a little bit of my own vaccine experience. Got it first shot actually 5 weeks ago, and then my second shot 2 weeks ago. And quite honestly, I had very minimal, if any, side effects at all. I had a little swollen lymph node, which my wife reminded me was only about that far from where I got the shot, but otherwise didn't feel bad at all. And coincidentally, my wife got her second shot just a few days ago and also no symptoms. Certainly heard of things, but we expect this with vaccines, and I'm here to tell you that I think the benefits of this vaccine certainly outweigh the risks, and I talk with my patients about that all the time. There's going to be some good and there's going to be some bad or potential bad, but when we talk about getting through this, seeing the light at the end of the tunnel, I think this vaccine is safe, and I think it's exceedingly important for everybody who's eligible to get it. So thank you very much.
So I'm lucky enough I've completed both of my vaccine, the two in the series. The first injection, I had a little soreness at the arm, but not much. The second injection, I counted, and I actually had 15 hours of not feeling very well. Took Tylenol and Advil, and the symptoms went away. But I was raised, do unto others as you would have others do unto you. So I've been using that adage with the COVID vaccine, because yes, I got the COVID vaccine for myself, but I got the COVID vaccine for my pregnant daughter. I got the COVID vaccine for my parents. I got the COVID vaccine for others. So I figured that's a good reason or good way to follow the golden rule, that I've got that COVID vaccine for others, because I'm hoping others will get it for me.
So the vaccine, I got the Pfizer vaccine through Columbus Regional Health, based off of, I guess, the county you live in. And the vaccine was 2 doses. The first vaccine was absolutely fine. It was didn't have any symptoms at all. The second vaccine, I was a little tired, but otherwise it was fine. It was very streamlined as well. And this is, of course, a new vaccine, which obviously there's some hesitancy, but I think hesitancy with any vaccine is, as long as if you do the research and you look at the science, you should be reassured that it's very effective, very helpful, and especially in this day and age with a virus as scary as it is, a way to help mitigate that or try to prevent you from getting sick is wonderful that we have that. You know, the goal of a vaccine is it's kind of a practice for your immune system, right? So it's a practice session for if hypothetically you were to get the real one, to be prepared for it. And any vaccine that obviously that's been streamlined like this one, I know it's was made rather quickly, but with very, very, very good evidence and very, very good science behind it. So if anything, it's very reassuring that we live in a day and age where we have the technology to make something so efficient and appropriate.
I signed up for the vaccine actually as soon as it was available. I got my vaccine the very first day that it was available, so it went well. I thought they were very well organized, and we walked in, they check your temperature, get you registered, get your vaccine, and then you have to wait for about 15-20 minutes afterwards. So they make sure you're not having a reaction or anything like that, and then you go. They set up your appointment right away that night, so you know when your next one's going to be. Yeah, I think, my motivations are probably similar to everyone else's. You know, the pandemic has certainly imposed a lot of social restrictions and has certainly interfered with our interpersonal interactions with family. I mean, you know, community events and religious organizations and things like that. So, you know, I want to get more back to normal with those. But, you know, for the same reason too, I tell people sitting here in the hospital, working in the hospital, we hear the codes. We hear when there are life-threatening situations related to COVID, and we don't like those. You know, I want those to go away. I want those to go away. So that's the big motivation, you know, for my family and for my patients. That's the big reason.
Hi, I'm Dr. Rebecca Hennessy with Schneck Primary Care down here in Seymour at Schneck. And I got the Pfizer COVID vaccine a few weeks ago. I got my first dose and had some left arm pain. And I got my second dose 21 days later and had some same left arm pain. And that evening was tired with very minor feeling cold, I got an extra blanket, and the next day I was pretty tired. I took a nap that day, and I've got 2 kids, so. But other than that, I didn't have any dangerous side effects. I didn't have any fevers or any other symptoms other than that for the vaccine. I think that everybody should get vaccinated. I would like to be able to go back and see my family back in Michigan and my 95-year-old grandmother.
We got my vaccine earlier in the month, and I really didn't have any trouble with it at all. The process was really easy, and I had COVID earlier in the year. Checked my antibody levels, and I didn't have any antibody levels. So I went ahead and bumped mine up and got it as early as possible, and I would strongly recommend the process to anybody. Like I said, tolerated it without any trouble, and I feel like it was just the best thing I can do to help get us back to normal.
But I think people fail to realize that the kinds of research with animal models, those preclinical trials with animals, the phase 1, phase 2, and phase 3 clinical trials with human beings are the exact same process we used with every medication and every vaccine that we put on the market. So nothing was done differently. It was just prioritized and condensed into a year. And I know that sounds like it was rushed, but I really have to emphasize that everything that was done in the development of these vaccines was done with the utmost scientific rigor and the utmost clinical investigational rigor. So we know they're safe now. In fact, 1.2 million Americans get the vaccine every day. I think over 25 million Americans have been vaccinated. And that's a lot of people. And so people should feel reassured that so many Americans have gotten at least 1 dose of the vaccine. And with that, we're learning more and more and more about safety. And what we're learning is there are no major red flags. And so far, so good. And with 25 million people, that's something, that's data that I can trust.